Good afternoon, East Chicago. I'm here today with Chief Health Officer Dr. Browning. We're here to give you an update on what's been going on in the city of East Chicago. We're here to try to give you precise, exact information. We're here to dispel any rumors. We're here to say that if you do not get accurate information, it only can be conceived as misinformation. So I'm here with Dr. Browning, who I rely on solely from his years and years of experience as being a doctor, being a physician, being a healer, and for the relationship that he has with his peers in the medical field to try to give me precise information. Misinformation does not empower the people to be informed. I'm here with the health officer. I've said it in 3 different languages. We're trying to send one concise message to the people. If this message zig and zag, can the message still go straight? But it just take a longer time. They say the shortest distance between 2 points is a straight line. And this straight line is going to go from me to the Chief Health Officer of the city, Dr. Browning. Dr. Browning?
Well, thank you, Mayor Copeland. I'd like to say good afternoon to the people of East Chicago. I hope everybody is doing well and social distancing as we had directed in the past, and we need you to continue with that. I want to just give you some factual information about the statistics in the city and here in the county, in Lake County here in Indiana. As of today, in Lake County, Indiana, there are 461 cases of test positive coronavirus infection. As of today, in Lake County, there are 12 documented deaths from coronavirus infection. As of today, the East Chicago Health Department, as notified by the Indiana State Department of Health, is actively tracking 18 cases of coronavirus infection, test positive. When a person dies, either at home or in the hospital, the physician that's presiding over their care is committed to completing a death certificate. And that death certificate should have all causes of death, including a coronavirus infection, if it's permanent, or a suspected coronavirus infection. If the person who has died has a suspected coronavirus infection, then hopefully they have been tested either before they die or posthumously, and then when the results of that test are available, that death certificate should be amended, either a confirmed death related to coronavirus infection or that suspected coronavirus infection would be removed from the death certificate in the amendment if the test turns out to be negative. Physicians are allowed some time to document a death in the death registry. So we may see some documentation of a death down the road within the next week or so. I personally think that the people here in the city are doing well. The biggest problem, as you may know, is that we don't have testing for the general population. I think that the statistics that are coming from some of the larger cities like Chicago, Detroit, New Orleans, and especially New York, they're all pointing to the fact, as I have spoken to you before, about health disparities. East Chicago, like other bigger cities, is primarily African American and Hispanic people. We have more health disparities, more chronic diseases like diabetes, hypertension, heart disease, chronic obstructive lung disease, and of course autoimmune diseases. These things make us more vulnerable to this particular coronavirus. And as is suspected, as is expected rather, many African Americans and Hispanic patients are dying from this coronavirus, much above the other parts of the population. I think that this is a warning sign for us. We need to continue social distancing, practicing hand hygiene, respiratory hygiene, wearing your mask. It's very important. The state of Indiana remains on a stay-at-home policy except for essential workers, and we cannot do anything to abate our vigilance in terms of continuing these very strict practices to protect ourselves, protect our families, and our people in the city.
And Doc, one area where I've been most proud of in this administration, we have dealt with the quality of life issues. And one of the biggest initiatives that we took when it came to quality of life was to improve our parks. We have put millions and millions into our parks in the last few years. And we can see in previous years, the parks was just bulging. It's probably one of the number one areas where family and friends go to congregate and to have a good time. Let it be to break bread together, let it be to watch their kids play in the new park equipment that we put in the playground equipment. But I have ordered all parks and the beach is closed. If you go now to the parks, you can see that we have secured the basketball rims to make it where you cannot play basketball. We find that that's for young folks that tend to be the number one area where they do their recreation at. So we have ordered all of the basketball rims shuttered. Then from there, we have crime scene roped off all of the playground equipment where you see the kids traditionally play at. Again, we've made major investments in these areas. Then last but not least, Doc, some of these areas you say we had been insufficient in or have been lacking in is just that physical exercise, getting out there, improving our physical health. We made a large investment in putting exercise equipment in our parks. Those have been shuttered and crime scene taped off and also enforced with barriers. We have again asked you to practice social distancing. Even today, even in this interview, most of the time you see at the federal level, the state level, you see the president, he'd be surrounded by all his men and women and his team, and they wouldn't have masks. You see the governor come on, he'd be flanked to the left and right with people. And Doc told me, no, we're gonna practice what we preach. This interview will be done in mask. You can clearly see it does not impede our communications with each other. But last but not least, we want to send out a precise message in the city of East Chicago that the simple things, wearing your mask, the social distancing, washing your hands, using the antiseptic or the sanitizer early and as often as you can, every chance when you touch a hard surface, when you interact from going inside an area and you come back to your car to disinfect it. The things that we normally take for granted, you don't even think about. Now these little things that can cause a hidden virus that you cannot see. I tell people, you cannot hear it, you cannot feel it. It's invisible. But with us working together, looking out for our neighbor, going to check on the elderly. One thing my daughter have taught me in this crisis, my daughter have made it her mission for her aunts, her uncles, her parents, that she go around, she get a grocery list from us. And once a week, she will go shopping for all of us, just to keep us from going out to the stores. And that reduces our exposure. But I tell people, we can get through this, Doc. We can get through this.
Well, I hope so. I think that we got our message out early about hand washing and sanitizing, and as the guidance has evolved, we're wearing masks, we're social distancing. I really believe that this is most important for preventing us from getting infected and keeping us safe. Again, I cannot overemphasize the fact that we're more vulnerable, and I think a high-risk, at-risk population, because we have more health disparities. I think it gives us a lot to think about our future in terms of how we look at our health and practice more of what we need to do to be healthy, stay healthy. But also it helps us look at our systems that, unfortunately, African American and Hispanic people, and of course people who suffer from poverty in general, they're either underinsured or not insured at all. We have poor access to health care still, and there are not enough physicians and nurse practitioners and physician assistants to provide enough health care for all of us. And we have poor access. During the last week or two, the current federal administration has moved to shut off access to applications for the Affordable Care Act, and therefore, if you even thought that during this crisis you might apply for that insurance coverage, you can't even get access to that. We are under attack, not just from this virus, but from all things that plague our community. So I just ask everybody to be vigilant. We have to live to tell about this and to work harder at taking care of ourselves, being healthier, and living the lives that we were intended to have.
And Doc, let me finish with this. Some of the misinformation that's going out there, there's some inheriting distances, social distances practices that you cannot apply. It does not apply across when you look at public safety, when you look at your sanitation workers coming. I tell people, you can see two police officers in a car and they may not be 6 feet apart. You can see the garbage men riding together and they won't be 6 feet apart because it's impossible for them to be 6 feet apart in order for them to effectively pick up your garbage. But the same thing, Doc, I tell them with the firemen. Firemen may come answer your call. You had a captain here, you got the chauffeur, you got the chauffeur here, you got the captain there. They may not be 6 feet apart. You may have two men riding in the back. They may not be 6 feet apart. It's the way the equipment is designed. But we've given them the knowledge. We've given them the equipment to wear their masks, to hand sanitizers, to wear their gloves. But can you imagine if we did not have the police out there, how crime could run amok? If we did not have the firemen responding, how you can be endangered. Sometimes this is your first line of defense when that first responder come to you and beat the ambulance there. Then not only that, if you didn't have your sanitation workers picking up the garbage, just imagine you will have your rats taking over. They spread disease. You have your raccoons. They spread diseases. You have your possums. They spread diseases. Then you have your roaches. So you have to weigh the odds. And what saddens me is when you can have the misinformation out there saying that we are putting them in a vulnerable state. No, we empower them with the information. They have become heroes because they have stepped up in the line of fire. And they come out there to aid and abet us in our most dire time of need. So again, East Chicago, I tell you, keep your eye on the prize. And the prize is when we defeat this virus. And the only way we can defeat this virus if we are on one accord and we spread a positive influence throughout the city. And we make sure when we give some information from point A to point B, that is knowledgeable information that's coming from our professionals, coming from the CDC, coming from the state of Indiana, our health advisors, coming from our local health agencies, that is coming from your fire department, your police department, the people who have been trained to respond when you are in dire need and it is an emergency, Doc. I tell you, we've been blessed in the city of East Chicago. One of these cases is one case too many. But as the doctor said, if we stay together as one, we will truly get past this. Can you think of some of the diseases in the past? We had SARS. We had Ebola. We had H1N1. And we can go on and on. But it's always take accurate information to get you through a crisis.